Hi, my name is Silpa and my MPH concentration is Environmental and Occupational Health. I'm also in my final year of training as an occupational medicine resident. Over the past few years, my research focus has been on deployment-related respiratory disease in military and civilian deployers returning from Southwest Asia locations, such as Iraq and Afghanistan. The title of my research study is The Utility of the Lung Clearance Index as a Non-Invasive Marker of Deployment-Related Lung Disease. The purpose of the study is to learn more about new non-invasive ways of detecting lung disease in U.S. military personnel and people who worked as contractors during military operations in Southwest Asia. Now I'm going to provide some background about Southwest Asia deployment and lung disease and why there's a need for this particular research project. Since 2003, over 2.8 million United States military personnel and civilian contractors have deployed to Iraq and Afghanistan. Deployment to these regions is associated with exposure to potentially hazardous inhalant mixtures such as burn pit combustion products, desert dust particulate matter, explosive blasts, local polluting industries, and microbial bioaerosols. Deployers have sometimes returned with respiratory symptoms of shortness of breath that's unexplained by traditional diagnostic testing, such as pulmonary function testing and chest computerized tomography, also known as CT scans. These individuals may be at risk for small airways diseases, such as something called bronchiolitis, that may only be detected on lung biopsy. The Lung Clearance Index, also known as LCI testing, has shown promise as a non-invasive marker of small airways abnormalities and other lung diseases such as cystic fibrosis. LCI scores of 7 or less are thought to be normal, while higher scores may indicate lung disease. I've hypothesized that LCI testing will provide a useful early marker of lung injury that will correlate with and predict abnormalities found on lung biopsy better than pulmonary function testing or chest CT scan. We have two specific aims. The first is to determine the utility and sensitivity of the LCI technique as a marker of lung injury in deployers with unexplained respiratory symptoms compared to non-deployed adults who have been matched for age and smoking status. The second specific aim is to examine the correlation between LCI score and the clinical characteristics of deployers. Inclusion criteria for this study include enrolling participants with a history of military deployment or work as a contractor in Southwest Asia between 2003 through present. Deployers have been recruited from the Occupational Environmental Medicine Clinic at National Jewish Health. Healthy adults who are not pregnant and have no history of pre-existing lung disease or prior deployment to Southwest Asia are being asked to participate in the study to provide test results for a normal group that will be compared to participants with known deployment-related lung disease. I'm currently wrapping up testing, having completed tests on 19 controls and 18 deployers already. The LCI testing requires basically a 45-minute to 60-minute session where we perform 3 LCI tests and then take the mean LCI of those results. The expected results and implications of this project. In thinking about this, I anticipate that the mean LCI score will be higher in symptomatic deployers with abnormal lung biopsies than in adult matched healthy controls. We expect that LCI indices will be more sensitive than pulmonary function testing and CAT scans in detecting deployment lung disease based on lung biopsy data when available. This could have tremendous impact in that if we're able to identify and validate a non-invasive technique, we could possibly prevent the need for an invasive procedure such as lung biopsy in diagnosing patients with this condition. And for the final part of the video, in answering where I would transport myself and go if I could for 2 days, I would choose to go to Nantucket, Massachusetts. I absolutely love the ocean, the serene atmosphere on Nantucket. I think of it as the ultimate place to go for rest and relaxation. Thanks for listening, and I look forward to working with all of you over the next few weeks.